This alley to me has been home for a very long time because it's where I slept.
Ash Mako knows the underbelly of drug addiction.
It is hard to see someone go from near death to breathing.
Good timing. And Narcan, the opioid reversal drug, helped him to save a man's life, but it's even more personal.
I carry Narcan with me because I myself have been revived with it, and if I wasn't, I'd be dead.
Ash OD'd on opioid pain pills. Every day, 2 people in our state overdose on opioids, and now a new threat, carfentanil.
When you heard about the carfentanil in the syringe, what was your reaction? Do you remember?
I was like, oh, crap.
Caleb Bantagreen is a researcher and scientist at UW's Alcohol and Drug Abuse Institute.
It's even that much more strong than fentanyl. And so you need even less of it to get a lot of people high on it or kill people on it.
The state crime lab discovered traces of carfentanil in a syringe mixed with other drugs right here at this unauthorized homeless camp near the Fremont Troll. It's where 5 people OD'd on the same day in January. We still don't know yet if that carfentanil is connected to those 5 overdoses, but the health department raised the red flag about it in this blog post, calling it deadly but rare in our state.
With these newer synthetic opioids we think are mostly coming in from China, they're so potent you just have to ship a little bit.
In short, it's here because it's profitable.
Carfentanil is used for large animals, not for human beings. It's not safe for human beings.
Bantagreen says users don't know what they're getting. It's sold as a white powder substance or in pill form.
We've been hearing about big increases in fentanyl and other fentanyl-related drugs from the East Coast and the Midwest for several years.
6 overdose deaths in Maryland were linked to carfentanil in 2017. In that blog post about carfentanil in Seattle, this advice: if you do illicit drugs, don't use alone and always carry Narcan.
I think it's really important to always use with a friend, always have Narcan or naloxone on hand.
Shiloh Jama runs the People's Harm Reduction Alliance in the University District and knows all about carfentanil.
It's on the streets. People know about it.
The Low Barrier Treatment Facility offers on-demand treatment and free Narcan.
We need to prevent every single overdose possible.
That's Ash's goal. His treatment helped him to land a job and his first apartment.
The struggle's finally over.
Now he's on a mission to help others.
You're doing good. Every day, I carry with me everything necessary for an intervention or a opioid response. You're very welcome.
Michelle Esteban, KOMO News.
All 5 of the people who overdosed at the homeless camp survived. There are places to get help and medication in our state. The Washington Recovery Helpline answers calls 24 hours a day. The number is 1-866-789-1511 or go to warrecoveryhelpline.org.
And in August, the state health department issuing a statewide order that allows anyone to get overdose reversal medication from a pharmacy without a prescription.